Welcome to VETport. I'm Tom Malloy, the founder of VETport and a veterinarian. This is the first in a series of videos on VETport's formulary. I'll be showing you how automating calculations in drug dosing and anesthesia can improve quality of care and save staff time. Why worry? In human medicine, tens of thousands of deaths a year in the U.S. are attributed to medication dosing errors. These types of errors are happening in our profession every day as well. When it comes to anesthesia, the death rate in human medicine, when controlled similarly to the first study I'll show you, is 1 in 10,000. You may want to sit down for our profession's number. There have been 3 large retrospective studies done on the question of anesthetic mortality in veterinary medicine. This large, often quoted study by Broadbelt in the UK puts the rate for anesthetic mortality in dogs at 1 in 588 cases, and for cats at 1 in 416 cases. Equines aren't covered in this study, but from Muir, in order to put you on your toes for that cold castration tomorrow morning, the anesthetic mortality rate in equine field anesthesia is 1 in 800. I castrated many colts over my decades in equine practice, and I'm glad I discovered this statistic late in my career. If those numbers aren't terrorizing enough, look at this study I stumbled on from a private hospital in France with an eye-popping anesthetic mortality rate of 1 in 75. Flipping back to the Broadbelt study, it gives a number we should accept as virtually inescapable, given the current state of the science. Somewhere between a mortality rate of 1 in 500 and 1 in 1,000 is the goal we should be reaching for in our standard of practice. Clearly it can be worse, but if we work hard to eliminate errors on our end, we can keep our practices in an acceptable range and assure our owners that we are doing the best we can with the care of their animals that they have entrusted to us. So how can we help you with VETport? In the series of lessons on VETport's formulary, we'll show you how to automate drug dosing and anesthesia dosing calculations in speedy and time-saving workflows. Properly applied, these tools spanning your career will perform hundreds of thousands, if not millions, of otherwise manual calculations where each manual calculation can be viewed as an opportunity to create an error. This will translate into improved patient safety and an improved standard of care. In the first lesson, we'll cover navigating the formulary, the components of the formulary, adding a drug, editing a drug, and connecting a drug to a plan item. See you in Lesson 1.